Taylor with SoCal EMS Training Institute. In this video, we're going to be talking about the skills of how to take vital signs. Like you guys learned in your acronyms, we use PR bells for how we take our vital signs. If you use that acronym, that's kind of an easy way not to skip things or to go in order. That way you don't miss any vital signs. So the first thing we're going to be going over is pulse. I'm going to take a pulse. I'm going to take my radial pulse and count for at least 30 seconds, if not a minute. You always have to have a watch, so make sure you guys have your watch on, and then just tell the patient just to relax and take your pulse, okay? While I'm doing this, I'm going to do it for 30 seconds and times it by 2. And then for the next 30 seconds, I'm going to look at my respiratory rate, okay? So let's say I counted for 30 seconds. Let's say I got 40 on the 30 seconds that I took. I'm going to times that by 2. His pulse rate is 80, okay? But that's not it. I have to see, that's the rate. I want to look for the rate, rhythm, and quality. I feel that it's regular and it's a nice strong pulse. So when I'm relieving that back to whoever's taking the vital signs and documenting it, I'm going to say 80, strong, and regular, okay? And then at that time, I'm not going to tell my patient that I'm counting his respiratory rate. I'm just going to do it. That way he doesn't change or get nervous or stop or increase his breathing. So I'm just going to look at that for 30 seconds. Let's say I count 8 times in that 30 seconds. I'm going to times that by 2. That's 16. So I'm going to say that's 16, and he's breathing full and effective, okay? Once I'm done with that, that's my P, that's my R. I'm going to take my blood pressure. So my blood pressure, I'm going to get my stethoscope out, my blood pressure cuff out. I make sure all my equipment is working and ready. My needle's in the right place. Sir, I'm going to take your blood pressure, okay?
Okay.
All right, go ahead and roll up your sleeve for me. I'm going to place this on nice and tight around his upper arm, with the arrow matching the artery where his brachial pulse will be in the inside. I'm going to feel for his brachial pulse. Okay. Keep your arm straight, okay? Making sure my bell on my stethoscope is on the right position. And while I'm doing this, I'm keeping his arm straight and I'm controlling his arm. That way he's not moving and talking and moving around, okay? I'm going to pump up to about 160 millimeters of, what is it?
Mercury.
Of mercury. And then I'm going to gently release to get my systolic pressure. Which is 132. And I'm listening for my last beat, which is my diastolic number, which is 82, okay? So 132 over 82. Once I've got my blood pressure, I'll take that off. We'll put that aside. So we got our pulse, respiratory rate, our blood pressure. Now we're going to get our eyes. All right, so Sarah, what I'm going to do is I'm going to have you look right here at my finger, and I'm going to shine a light in your eyes, okay? So I'm checking his pupils, make sure that they're pearl, which are equal, reactive, round to light. So I did that twice because at once I checked his eye, which turned from a 4 to a 3, which was good, and his other eye was reactive as well. So look right here again. And again, his was 4 to 3, so his eyes are pearl, equal and reactive, round to light. Now we're going to listen to lung sounds. So from here, I'm going to put my stethoscope on. So sir, I'm just going to have you sit up straight. Okay. I'm going to take a couple of, listen to your lung sounds, okay? Nice deep breaths, okay? All right, go ahead and lift your arm up, sir. Nice deep breath. All right, so lung sounds are clear bilateral. I listened to to the front, to the side, and to the back of his lung sounds. All of them sounded good, so therefore his lungs are clear bilateral. Okay. Now I'm going to reassess my level of consciousness if you haven't done so already. So ask him his A&O times 4 questions. Sir, what's your name?
My name's Tyler.
Okay, do you know where you are right now?
I'm at school.
What year is it?
It's 2020.
And why are we here today?
We're learning about vital signs.
Awesome. All right, now next is going to be our S, which is going to be for our skin signs. So from here, I'm looking for color, moisture, temperature. Okay, so right now, his color is normal, pink. Moisture is dry, and his temperature is warm. So he's normal, warm, and dry, and pink. From there, I'm going to check my SpO2 level. If I had my SpO2 monitor, I'd stick that on his finger and assess that. That's where you're going to see if you're going to need to place that person on oxygen and determine their SpO2 level. From there, as well as with our PR bells, we've completed that. If they are a diabetic patient, we can potentially start talking about blood glucose level. We can get our glucometer out, check that. We can check a GCS score. We can pull out our monitor if you're with someone with a monitor and get their 4 lead, a 12 lead. All of those other videos or all those other vital signs will show in a later video. But besides that, that's how you take a blood pressure, pulse, respiratory rate, eyes, lungs, skins, and SpO2. Thanks, guys.